The first Noel, the angels did say, was to certain poor shepherds in fields as they lay, in fields where they lay keeping their sheep on a cold winter's night that was so deep. Noel, 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 born is the King of Israel. They looked up and saw a star shining through east, beyond them far, and to the earth it gave great light, and so it continued both day and night. Noel, 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 born is the King of Israel. And by the light of that same star, 3 wise men came from country far to seek for a king was their intent, and to follow that star wherever she went. Noel, 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 born is the King of Israel. Noel, 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 born is King of Israel.
Wow. Well, welcome everyone. Welcome to our foundation family, to the Barwon Health Foundation Year in Review. I mean, just looking at all of those images, it's really, I'm nearly teared up. It's just what an extraordinary year we've experienced. And the Barwon Health Foundation has been at the heart of it for the entire year. I'm not quite sure how the rest of us would have gotten through without them, but I'm pretty sure we wouldn't have gotten through without you and your support as well. My name's Roxie Bennett, and I'm so excited to be your host today on the Year in Review. I'm a director of the Barwon Health Foundation, and it's my great pleasure to very shortly introduce you to our panellists in this webinar. Now, the webinar, whilst you'll see us, we can't see you, but if you do have any questions, hopefully we'll have some time at the end. You can pop them into the chat facility on your Zoom. So we would love to hear from you. Just before I go though, before I go into the next thing, how about that music? That was Stella Perry performing on Saturday night at our Christmas Gala, the Gala Christmas concert. And what an amazing job she did, but how beautiful was that to go with those images? Before we go any further though, I would like to do the official Acknowledgement of Country. We, the Barwon Health Foundation, acknowledge the traditional owners of the land, the Wadawurrung people of the Kulin Nation. We pay our respects to elders and past and present. We thank the traditional owners for custodianship of this land and celebrate the continued culture of the Wadawurrung people and acknowledge the memory of their ancestors, their honourable ancestors. We also welcome all Aboriginal and Torres Strait Islanders who are joining us on this webinar today. So today's Zoom, I'm going to introduce you very shortly to our amazing panel of guests. We are expecting one more to join us, but I'll run through so that you can get to know everybody that you're going to be hearing from. And just from what I know about our guests, you know, we're so extraordinarily lucky at this time of year to grab an hour of their time and hear about their thoughts on 2020. First of all, I'll kick off with Kate Gillan. Hi, Kate. Kate was appointed to the Barwon Health as our new Chief Nursing and Midwifery Officer in July last year. Kate had previously, well, certainly was no stranger to leadership in health services. She'd held positions both the private sector and also the public sector. She was the former CEO of the Lawn Community Hospital in Otway Health and Director of Clinical Services and Director of Nursing at St John of God. Now, Kate's primary role is leading Barwon Health's nursing and midwifery workforce. And you can only imagine what that has been like this year. Her experience has obviously come into play, and her leadership was an amazing asset to our health service this year. Kate is passionate about providing great healthcare for our communities and enabling excellence in nursing care, and also enabling our workforce to excel and be their absolute best. I think there's also something really passionate that Kate's about, and that is that this is our community's health service and we want our community to have the best service it can have. So welcome, Kate.
Thank you.
Jacob Baird is our next guest. Jacob comes from an IT background, can't you tell? No, I'm joking, Jacob. Actually, there's a lot more light in your office than most IT people. And maybe that's because you've come from, you're starting in a different area, or you're in a different area now at the hospital as pretty much our project and design manager of all our new projects. So you took up this great opportunity in health construction, and you've developed your set of skills in the construction of all of the things that have been happening around the hospital, and in particular in your role as Director of Capital Works at Barwon Health, to provide direction and management for a portfolio of the major capital works right across their project life cycle. And as you can imagine, that is a huge role. And, you know, we welcome you here and can't wait to hear a bit more about some of the exciting projects you've been working on in 2020. Thanks and welcome, Jacob.
Thanks, Roxie.
Jacqui White is a qualified social worker and has been for almost 30 years, although she barely looks a day over 35, so I don't know how that works out. But anyway, Jacqui holds a Bachelor of Arts and a Master's of Women's Health, also a Master of Gender Studies, along with specialist certificates in both palliative care and leadership and management. Prior to joining Barwon Health in 2007, Jacqui was employed in a number of settings within the public health sector, both in Australia and internationally. So you can only imagine the amazing experience Jacqui brings to Barwon Health. Joining initially to work in both the palliative care unit and community palliative care programs as a senior social worker clinician. And since this time, Jacqui has held a number of roles with the program, including supportive care team leader and community palliative care coordinator. Jacqui has been working as the palliative care program coordinator since 2017. And just prior to coming on, we were discussing the fact that palliative care doesn't stop because it's Christmas. And in fact, it's a 24/7, 7-day-a-week job, as we would all be aware. Now, Associate Professor Philip Campbell hasn't joined us just yet, but as you can imagine, with somebody with that title, he's going to be pretty busy, but we're hoping he'll get on the call or onto the webinar in time for our questions. And I'm kind of a little bit excited that he's not here, because when I'm describing what he does, I've got to use a lot of really clinical terms, and I'm not really sure how well I'm going to do at that. You may not know the difference, but I'm pretty sure he would. So let me get started. Philip is the head of clinical haematology and director of cancer services at the Andrew Love Cancer Centre. And I know the centre quite well, having been a patient there myself a number of years ago now, but it is an amazing centre, and what they do is extraordinary and touches so many of us. The centre, of course, is a part of University Hospital Geelong, and also Philip holds a conjoint appointment as Clinical Associate Professor at Deakin University in their School of Medicine. Now, Philip established Victoria's only autologous stem cell transplant service in 2003 in collaboration with the Royal Melbourne Hospital Bone Marrow Transplant Service. In collaboration also with colleagues in the Nuclear Medicine Department at University Hospital Geelong, he led the development of Australia's only isotope labelled platelet sequestration service as a tool for predicting platelet responses to splenectomy in the management of immune thrombocytopenia. His clinical research interests include multi-centre collaborative national and international trials in chronic lymphocytic leukemia and multiple myeloma. That was the easy one, I'll move on. Philip has published more than 60 papers in peer-reviewed journals and has presented regularly at national and international haematology congresses. So as you can imagine, he knows his stuff. Last but by no means least, the most festive of us all today is the Executive Director of the Barwon Health Foundation, Zoe Waters. Zoe studied social work at university and has worked in the non-profit sector for some 16 years now. She spent most of that time working in mental health, child protection and children's rights, and for the past 9 years at Barwon Health as Director of Volunteer Services. About 18 months ago, Zoe was appointed the Executive Director of the Barwon Health Foundation. Zoe is a board director at Volunteering Geelong, was an inaugural member of the Ministerial Advisory Council for Volunteering, which is quite an extraordinary role. She was recognised as a finalist in the Telstra Business Women's Awards and winner of the Regional Entrepreneur or Manager of the Year in the NAB Women's Agenda Leadership Awards. Please welcome Zoe.
Merry Christmas, everyone. I'm excited to be here, Roxie.
Well, I'm so glad to have you all. Now, we might just kick off with some questions, and I might actually go to you, Zoe, to start off this. You took on the role 6 months before COVID. How on earth has the past year been for you?
It's been a year like no other, and I think if we use the terms unprecedented, pivoting, if I hear you're on mute one more time, we might be rocking in the corner somewhere. But I tell you what, it has been a challenging year, but boy, it has been a really rewarding and inspiring year as well. If we have a look back at what we were doing on the 4th of February, I'll never forget it. The team and I had our planning session. We planned every event, every activity, down to the last social media post, which had never been done before. And then COVID really hit our region in sort of mid-March, and that all went out into the water, and it was going to be a year of unknown and a year like no other. But I think for us, we've been really proud of what we've been able to achieve with thanks to the local community. We had a bit of I'm calling it a sliding doors moment in mid-March, where many of the charities across Victoria were closing their doors or reducing their operations because of the fear of COVID. And we had many a conversation, many a debate around how the Barwon Health Foundation should respond. And we quickly decided that we needed to launch Victoria's first COVID-19 response fund to be able to support Barwon Health in their response to COVID. And it went on to be one of the most successful, if not the most successful in Victoria. So a challenging year, a year that I'm certainly glad to see the back of, but a year that I'm so incredibly proud that we were able to support Barwon Health to keep our community safe.
Oh, absolutely. Now, Kate, it must have been an odd thing for the nursing staff and for you, because it was almost like watching a tsunami coming towards us and not really knowing how, when, or what was going to happen when it hit. Can you sort of give us a bit of an idea of what that experience was like?
That's a really good description. So we were seeing what was unfolding in Europe, particularly Italy, who was the health professionals there were quite active in sharing across the world what they were experiencing. And we knew that all the potential of what could come our way if we got an outbreak that was unmanaged. And so it was really clear that we needed to contain this as much as possible, because what happens when health services get overwhelmed, as we're seeing in other parts of the world at the moment, is that they actually stop being able to deliver life-saving care to people, and people end up dying unnecessarily, but for the ability to intervene. So it was a very clear picture that we had of the potential that could occur. So really started what we were calling building the plane as it was flying. So being able to really think differently about how we did things and how we anticipated or planned for what could potentially emerge, but it was a lot of guesswork in that planning.
Yeah, I bet. And I think part of that planning too for you must have been around managing the tension that had to exist for the staff.
Yeah, well, it was interesting. There was predominantly a very strong stepping up. People seeing that this was a time that they needed to respond. It's what they'd been trained for. It's what they saw as their responsibility, and people did. So in the first wave, we were planning for ICU admissions, and we knew from overseas that ICUs became overwhelmed in the first wave. And so, we put out an expression of interest for nurses to do a crash course in ICU to be able to step into that space. And we got absolutely inundated with people who were wanting to respond. And so we did a lot of training, a lot of preparation, and interestingly, in the second wave, it wasn't in ICU where we experienced the cases. It was in aged care. And again, in that second wave, people really responded. We had to take a team in at very short notice to support the residents in the Belmont outbreak. So 40 nurses stepped up within a couple of hours, and we looked after those 90 residents to avoid them ending up in, not cared for or ending up in emergency department. So it was really amazing, the response from staff and right across the organisation.
Gosh, I mean, we can be so proud of all of them. Now, Jacob, one of the big campaigns that the Foundation's been managing on behalf of the community has been raising several $1 million for the Kids Rehabilitation Centre. That was your big project for 2021. You've actually gotten it through to the design stage. Like, how on earth did you manage that without even being able to meet in person? It just seems inconceivable.
Thanks, Roxie. Yeah, like everyone else, I guess you just have to adjust to the new normal this year. Sorry, Zoe, that word, I probably didn't want to say it. But, it's been quite a challenge. And, you know, the first wave, as you said, Kate, it sort of hit in a different way. And we tried to work through here and get things done in person, but gee, it was getting tricky. So we ended up doing most of our consulting and design meetings over Zoom like this. And funnily enough, it actually has worked better for us, I think. You know, we don't have that commute and nobody's driving. Our architect was in Apollo Bay, our service engineers were in Melbourne, and we were in the middle. And we had all our consumers around us, and everyone was able to dial in, and it was just a really easy experience. So I think we'll probably do it again.
It's changed the way things have happened. So it's been a particularly tricky year, 2020, I think, for most of us. But you would have to say that our palliative care programs in particular must have taken a bit of a hit in all of this. Jacqui, can you give us some thoughts around that?
Yeah, absolutely. I think it has. It's been a really difficult year for everyone, but I think, like Jacob and Kate said, it's also given us the opportunities to think really creatively and to consider different ways of doing things. So, you know, we've tried to be, and this is probably another one of those catchphrases, so sorry, Zoe, you know, we've tried to be really flexible and agile as a program, because I guess ultimately the core of what we want to do is to provide the absolute best possible care we can to the people of our community. That's the central thing. So if you start with that as the core, it was thinking, okay, how can we actually change the way that we do things and implement, you know, different ways of being? And I think particularly for us, what we noticed as people were, I guess, trying to, as much as possible, stay away from hospitals, the rates of referral for our community palliative care program in particular just grew exponentially. So we were trying to both deal with a really increased workload whilst doing things really differently. And I guess elements of our program weren't able to work. You know, we have a very strong volunteer focus, and, you know, because we wanted to keep our volunteers safe, you know, our volunteers weren't working with us for, you know, a fair chunk of the year. So that changed as well, the way that we deliver care. You know, palliative care has a really holistic focus, and our volunteers help us to do that. So, and I guess the thing that we noticed significantly, we changed a lot. We used a lot of telehealth. We developed relationships with people via telehealth, and, you know, ebbed and flowed as much as we could, trying to work our way through that. And I think the thing that we noticed that was probably the most challenging was how we supported people through the grief and bereavement phases. You know, it was a really, it's different. You know, bereavement in 2020 looks very different than it has done. You know, a funeral looks very different than it has done previously. Our opportunity to link with our community, which is what we do when we're bereaved. You know, we engage, that's our sort of gold standard of trying to engage people back into the community, really wasn't as possible as it had been. So yeah, it's been a really interesting year. There's lots of learnings, I think, that we'll take from it and go, we'll keep doing that. Like, we'll keep focusing and using telehealth, but some things that I'll be very pleased to wish 2020 farewell. So
yeah, I don't think you'll be on your own there,
No.
Kate. Now, we had Philip on for a moment, but we've seemed to lost him again, so hopefully he can jump back on very shortly. Ah, there you are, Philip.
Yeah, sorry, I apologise for being late. Sorry.
No, welcome to the group and to the webinar, and to all of our supporters who are tuning in. It's lovely to have you here. Philip, you'll be pleased to know that when I did the introduction for you, I pronounced everything correctly, despite my lack of technical knowledge. maybe not. Philip, well, while we've got you here, with the COVID restrictions, like how is that from your perspective in the Andrew Love Cancer Centre? How on earth have you managed all of that?
Well, I mean, the common thread here, of course, has been difficult for everybody and for all clinical services, but also for society in general. But I mean, we've had to, as Jacqui said, be very flexible. One of the things that's really come out of COVID-19 is just how cohesive and integrated the cancer community is in Victoria. So a lot of the clinical directors at the different sites around Victoria have been getting together regularly to via Zoom meetings to compare experiences and share expertise, and that's been very useful. What we've been trying to do in terms of managing our service through the pandemic, of course, is reducing exposure to patients. So obviously exposure risk is higher in patients who come to health services, and social distancing, doing a lot of telehealth, for example. We're stretching out our treatment hours for longer periods of time. We're deferring what we consider to be non-essential treatments in certain situations. We've tried to do more treatment in the home as well. And this is because we know from international data that the actual mortality rate for cancer patients is actually around about 30% from COVID-19. So particularly patients who are having active treatment, they're particularly vulnerable. And often this is because these patients have other comorbidities. Often they're elderly, they're on immunosuppressive treatments, have low blood counts. And these are risk factors for adverse outcomes in relation to COVID-19. But in saying all of that, though, we've been very fortunate in that we've had no cases in any of our patients, in any of our staff. It's a testament really to the fantastic effort of Barwon Health, the contact tracing team, and broadly across the region, that really COVID has minimally impacted our cancer service in terms of patient welfare and staff welfare. It's beginning to take its toll in terms of the silo effect, the fact that people having to work from home, for example. Patients and staff really thrive on those important interactions between clinicians, nursing staff, and the patients themselves, and admin. Extended hours are very tricky, and there's a lot of fatigue that is starting to occur, and really we're getting to a point now, hopefully with the easing of restrictions, that people are going to get some time off and recharge and revitalise for the year ahead.
Now, Jacqui was just mentioning about the use of telehealth. I'm interested in how, like, SIP was fast-tracked, obviously, because of the pandemic, and I've engaged in it a few times, but how has it worked with you guys at the Andrew Love Cancer Centre?
So telehealth for us consists of either telephone consults or direct face-to-face telehealth, usually using Health Direct. And look, we've used a lot of it. About 30%, 40% of our consultations have been done remotely. I think it's fair to say that it does work for some situations really, really well, but others it doesn't. And it's the adoption of telehealth is something that's been promoted, particularly for rural and regional communities, for a long, long time. But obviously COVID-19 has accelerated the relevance of telehealth. And I think that really we've gone into COVID and we've embraced telehealth, but really without really knowing how to use it as best we can. And we're currently involved in a statewide audit of telehealth services where clinicians, patients and their carers, and allied health staff as well are providing feedback on telehealth. And the aim of that audit is to look at gaps in the service, to look at how we can do things better, and to try and standardise it. And I think certainly going forward, we know that Medicare recognise the importance of telehealth, and that will continue to be funded going forward. And I think that's going to be with us for a long, long time. So I think in answer to your question, I think we've certainly embraced telehealth. We've worked out really what we think are the right clinical scenarios for telehealth, which patients can be remotely managed, which patients need to be seen face to face. but I think, you know, there's still a long way to go in terms of trying to standardise the whole process. And I think this statewide audit and the establishment of a statewide and national guidelines will be very, very useful.
Absolutely. Now, Zoe, you mentioned earlier that you guys had started off the year with everything sorted and everything locked in, ready to go. Didn't quite work out.
So Roxie's frozen there.
Which is, you know, as you can imagine, was going to be a bit of a surprise for you. But you guys really have worked harder than really you probably ever have before.
I think, like all teams at Barwon Health, it's really an honour and a privilege to work within the health sector. So although working harder and smarter, not harder, and all those types of things, it really has been, you know, we chose to work in health for a reason, and we chose to work in health because we wanted to help people. So although it's been a challenging year, and I don't think we've ever looked forward to the Christmas break like we have this year, I was reflecting before this webinar on the things that the team have pivoted to do this year. And it started with the drive-through testing clinics that were set up very promptly across the region by Barwon Health. And the team and I were standing there with the stop-go signs directing traffic through the drive-through clinic. So that was the start of it. We hand-delivered hundreds of care packages to patients that were diagnosed positive with COVID-19 in Colac. We literally served curry to healthcare workers out the front of our office on a really cold and miserable July day. I think there's been around 4,000 coffees distributed to healthcare workers on night shift and those out in the community. Something like 3,500 hot meals were distributed as well. And quite literally hundreds and hundreds of care packages, including care packages for staff whose faces had been affected by wearing PPE for long periods of time. But I really want to thank my team. We're not clinicians, but we are certainly thrilled to be able to support clinicians through this time, and not just clinicians as well, the leadership, the administrative staff, the support staff, cleaning staff, infectious diseases staff, research, clinical trials, and the list goes on. It's been a wonderful year of giving back to the healthcare workers who have looked after us during this challenging time.
A little bit later, I'm going to get you to go through the achievements, the key achievements of the foundation. I think everyone will be fascinated with that. But just before that, I'd just like to go to you, Kate. During the year, there was a new strategic plan came out for Barwon Health of all years. Do you want to tell us a bit about that?
Yeah, sure. So there's been a lot of work through the year in developing that plan. So consulting with various different groups and people, and looking at the data and how our region and our community is going to grow and how we need to respond. And so the development of it took a 30-year vision for a 5-year plan. So really taking your mind out 30 years makes you realise how much things will change. And so much of what we're doing today, we won't be doing in 30 years' time. So that was a valuable exercise to then chunk up the next 5 years and how do we need to prepare for that. So the theme of the strategic plan, which was launched yesterday, is future ready. So 3 key areas there. That's being delivering best care, investing to improve, and ensuring our future. So under those 3 criteria, there's a range of areas that we'll be focusing on. So it's pretty exciting at this time, at the end of 2020, to be thinking about the future, because I think we're all ready to be doing that.
Yes, and not that we can necessarily predict it, but at least if we're prepared for whatever comes, it's going to be a good thing. Obviously, that was released yesterday, so people will have access to that, and we can provide those details for them.
Yeah.
Now, Jacqui, just really quickly with you, you mentioned earlier about how you guys in the palliative care unit sort of changed a bit in the way that you were doing things. Can you give us some examples of that, and what was some really good successes for you?
Sure. I think, you know, I talked a little bit before about telehealth and the implementation of telehealth into our services. I think that was a really good example, excuse me, of innovation and flexibility. I think we had to really critically think about how we provide grief and bereavement services. So normally, for example, we have a reflection and remembrance service which runs annually. That's normally a face-to-face, you know, in-person service. So we had to really turn that on its ear very much and develop a virtual service. So with the help of comms and marketing, we did that, and that was fantastic. It worked so well. So it was one of those things I think that we'll take into 2021 and beyond in terms of actually having a mix of both modalities moving forward. And I think that's probably the take home for us, is that we've really thought about you know, the different ways of having to do things and what can we continue on. Things like our exercise group, we run a physio exercise group, which is normally obviously face-to-face. We've done that virtually. Reflection and remembrance, a lot of our have a go legacy type work, we've had to change the way that we do that so that we could do it in a really COVID safe way. So not having contacts and not utilising our volunteers in the same way that we might have previously. So yeah, lots of different ways of doing things.
It's just wonderful that we are, you know, put in a tough situation and you think of new ways of doing things. It's just fantastic. Now, slightly out of that focus for the moment, Jacob, our foundation has a very strong relationship with the Blue Ribbon Foundation, and one of my fellow directors, Ray Frost, actually attended an event last week where he was presented with a cheque for $150,000 to the Barwon Health Foundation. Now, the money's going towards the emergency department refurbishment project. Can you describe to us what that money's going to do and how it's going to change the experience for people attending the emergency department?
Sure thing. Yeah, we're very lucky to be the recipient of that, and from a great foundation in Blue Ribbon. But this money enables us to extend on an existing project we've already been funded for from the state. But this money gives us the ability to move from 2 assessment bays to 5 in ED. So basically, when you come in, patients come in on an ambulance, there's sometimes a queue, you know, just the nature of how it works. What we're going to do with this money is build 5 cubicles and fit them out with all new finishings and really nice non-clinical look. So basically you get that sort of entry to the hospital. It's not a big stark white room. And, you know, of course we need to get all the equipment and everything that goes with an admission. And that 150K has really made the difference for us to be able to do those extra 3.
Isn't that exciting? That's fantastic news. Now, Philip, moving back to COVID-19 again, the media has reported the impact and quite extensive impact on health workers. How has that impacted the staff at the Cancer Centre?
Look, I think, you know, really our staff have been shining lights during COVID and have provided a wonderful service in the face of the difficulties that COVID poses. But you know, there are some people who found it very, very hard, and certainly working from home, working in silos, obviously reduces contact with colleagues as well. And the other issue, of course, now is the preparation for this so-called surge in cases, because a lot of people have been deferring going to see their doctor or having screening investigations. So we expect to see an increase in cases. So this, you know, this also plays on the minds of health service staff as well. The other issue, of course, is that, you know, in the early stages of the pandemic, in fact, there was actually, you know, a perception that healthcare workers were risky individuals in the community, and that they were, you know, sources of COVID themselves, and that, of course, you know, stigmatized people who worked in healthcare also. So that was something else that people who had to contend with. So it sort of happened on all sorts of levels, really. But, you know, in the face of all that, our staff have really been absolutely fantastic and provided great care to our patients during what's been a very difficult time, and hopefully we're, the worst of COVID-19, certainly here in Australia, is behind us.
Yes, let's hope. Jacqui, today we've got people joining us for the webinar who are great supporters of the Foundation and the Barwon Health and University Hospital and all the services we provide. How does philanthropy assist what you do in the palliative care unit?
I guess it's made a huge difference to what we can do over the years. We've had such amazing support. I think one of the things that obviously our clinical care is funded through our government funding, but all of the things that we do that adds to our holistic care, the Backyard Blitz programs, the Have a Go, which is a legacy program, our dignity therapy programs, life stories, we've got a terminal medications project. None of those things are possible without the support of philanthropy and fundraising. We're just so very grateful for the support. We get a lot of support from obviously from the Barwon Foundation, but also from Hospice Foundation Geelong, who are always open to coming up with some of our more wacky ideas and helping us. And I guess it takes us back to the thing I said before. The people that we care for, our community, are core. So we try and actually identify the projects that's going to make their lives the best quality that we can, and fundraising and philanthropy help us to do that.
Isn't that awesome? Well, it was a lot of what was behind the establishment of the Kids Rehabilitation Centre, Jacob. So do you want to give us an update on that building and how the donors will be acknowledged with regards to that?
Sure thing. As I sort of picked up on earlier, we've been able to wrap up the design this year despite COVID, and we're heading into a bit of a break, and then we're going to put it out to market, and we're hoping to get the first shovel in the ground in March and run through to the end of 21. So hopefully by the end of the year, we have a brand new facility. And with regards to donors and their contributions, we've got a number of different ways of acknowledging them. One of them is a really nice bit of art that's going to go in the central area. It's a big screen that is laser etched steel with people's names that have contributed. And we're going to have various plaques and also a digital presentation in there. So it all sort of blends together, I guess. We don't want it to stand out, but we do want to acknowledge the great contributions everyone's made.
Yeah, absolutely. Zoe, I might get you to give us a bit of an update on possibly one of our most exciting things this year, the Adrian Costa Clinical Trials Centre. Do you want to tell us a bit about that?
I think you're right, Roxie. I think it's probably been, through a challenging year, the shining light for the Barwon Health Foundation team. We've been working really closely with the Costa family for a little while now to come up with the perfect project that they would like to invest in to honour the legacy of their late brother, Adrian. And we went there with a huge presentation with Professor Peter Villeman and Francis Diver, and we asked for a certain amount of money to be able to build a dedicated clinical trial centre. Costa family, true to their name and their generosity, came back with a little bit more than what we'd asked for and asked us to build the regional Victoria's best clinical trial centre. They're a very passionate Geelong family, like everyone is well aware, but they were so passionate about making sure that people in our region had access to clinical trials exactly the same way that people living in metropolitan Melbourne did. And they're really motivated by making sure that the health of Geelong is deemed as good, if not better, than the health of metropolitan Melbourne. So it's been a great honour to work with the Costa family. And again, true to the generosity, they also made a significant donation to the COVID-19 Emergency Response Fund. So it's been a real pleasure to work with them. But another achievement was the COVID-19 response fund. We set out with an ambitious goal of raising $1 million, and we raised a little bit more than that, and it funded practical things like 50 new hospital beds so that those beds are standing ready for the COVID ward, funded vital signs machines. I know there's many people on this webinar that contributed significant amounts of money to be able to purchase around $800,000 worth of equipment. But it also funded things like the cups of coffee, the meals, the hampers, the care packages that went out to the community as well. A couple of the other highlights too, and I really want to thank our team for this, is two of our major events that Geelong know and love and have supported for many, many years. Gala Day was in its 104th year this year, and we faced the challenge around what do we do? Do we cancel Gala? Do we change Gala? And it evolved into this beautiful, magical Christmas concert, which Roxie and Dennis Walter hosted and showcased the talent that is here in Geelong. We also then had Run for Geelong, and that raised $115,000. So there's been lots of highlights throughout this year.
Yeah, just amazing. I've got to say, I loved the iPads that went to the people in the aged care facilities so that they could have communication with their families. I think that just gives me a big warm hug thinking about that. Now, Philip, Zoe mentioned the Adrian Costa Clinical Trials Centre. Obviously, the cancer services clinical trials are really important. And in fact, when I had my cancer treatment, I was involved in one, which is, you know, it's always there for the future people. How are you seeing that?
Yep, so that's right, Roxie. So we have a strong commitment to clinical research at the Andrew Love Cancer Centre and have done for many years, and we have about 30 active clinical trials running currently. So COVID, for our clinical trial patients, you know, we have been adopting the same COVID-safe clinical practices we've all talked about today regarding sort of social distancing, and a lot of our clinical trial protocols that we run have had to be amended to make them COVID safe, and that's had to be submitted to our Research and Ethics Governance Office, and also these amendments have to satisfy the sponsors of our trials as well. There are some clinical trials where we know that patients have effective alternative treatments that would minimise their risk of coming to the centre and having treatment, and therefore expose them to COVID. So we've deliberately steered patients away from those studies, but there are other patients who are in situations where there is no standard of care. They don't have any other realistic treatment options. So we've been trying to encourage patients to continue to participate on those clinical trials. So so that's where we are at the moment, and we're, you know, just to echo Zoe's comments as well, we're very excited about the Adrian Costa Clinical Trial Centre announcement as well this year.
Yeah, it's wonderful. Kate, I'll jump over to you for a moment. What's your view on 2021?
Bring it on, bring it on. We can taste that Christmas ham, and then we're heading into a gorgeous summer. And I think for most of us, a little rest, which will be great. But it is an exciting 2021. So apart from the strategic plan that we've just talked about and that future ready focus, we've actually come out of this experience through COVID with a really strong regional focus. Barwon Health led a lot of the work around contact tracing and supporting aged care right across the sector, right across the region and so on. And the department are really supportive of the regions continuing to work together really strongly. So we need to catch up on care. So we've got a deferred care program. So that's about doing a surgical blitz. So we're hoping to open some of the Building B theatres to be able to catch up on surgery that we weren't able to do in 2020. So we've got a whole bunch of equipment we need to buy for that. And also continuing that telehealth program and moving around, Jacqui referred to it a little bit, about enhancing the opportunities of keeping people at home for care, all sorts of ways that we can keep people at home rather than bringing them into a hospital. And so there's a lot of work that's going to happen in that. So that's going to be a really key focus for the region and for Barwon Health's leadership in the region.
And you spoke about the need to, fit out Building B. obviously community support is so vital to projects like that.
It is, yeah. So just a message of thanks for the support through 2020 from the foundation and the community. It's been really very appreciated this year and really strongly felt by the staff. And there are a number of areas where people can continue to support Barwon Health and the foundation. And this is another area that we've been able to identify. There's, I think, over $1 million worth of equipment that we need to establish those additional theatres and to catch up on. They're estimating around 70,000 cases, theatre cases across the state that haven't been able to be done. And so that's a really important focus to enable people to achieve tap into a service that they haven't been able to have in 2020.
Wow. Now, before we wrap up, Zoe, I'll hand over to you again. Can you please tell us what 2021's looking like from the foundation's perspective? Can you look ahead and give us a snapshot?
Well, we had a planning day on Tuesday, and I'm nervous that that is going to set us up for a similar year to what we had this year, but I've got full confidence that it's going to be a much better year in 2021. And Kate touched on it really just then. We've got three focuses, or major focuses for the year ahead from a fundraising perspective. And that is to finish raising the 600,000 needed to build the children of Geelong a dedicated rehabilitation centre. So that's really front and centre for us. We made a commitment to local families that we will have this centre by the end of next year. And the team and I are 100% committed to making sure that that happens, COVID or not. Isn't that right, Jacob? We've got that on recording. The other one that we're focusing on, as Kate touched on, is helping Barwon Health with their surgery blitz and fundraising to provide the equipment that's needed for the theatres. So that's another focus for us. But the other one that we're really passionate about, and you know, we get emotional every time we go out there, is the palliative care unit, horticultural garden, therapy garden. We're really passionate about making sure that we raise the 250,000 plus in the next financial year to be able to make that project come to life. And that is essentially about providing an environment within the garden that acts as part of the holistic approach that palliative care can offer their clients, both within the palliative care unit, but also the pallet home clients as well. So that's something that we're really working hard on. But overall, our goals are simple, and that's to create a happier, healthier Geelong by investing in Barwon Health.
Isn't that wonderful? Look, I think we are just about to wrap up, but Zoe, before we go, I'm sure there's a message that you would like to give to the wonderful people who are tuning into the webinar today.
I think, thank you. I know it sounds tokenistic, and I'm sure everyone's heard it a million times this year, but thank you. Thank you for trusting in us. Thank you for investing in us, and thank you for ensuring that Barwon Health and our region, the Barwon Southwest region, has the very best healthcare, because I know that when I need it or my loved ones need it, I want to make sure that we have the very best care here. And it's been such a pleasure and a privilege to be able to support Barwon Health in the response to COVID, but also the relationships that we've formed with the clinicians, the healthcare workers and the support staff has been phenomenal. But to all of the supporters that are online right now, I wish I had the words to say how grateful we are. We've had, you know, I said to Francis Diver yesterday, close your ears, but the foundation's actually had a really positive year, because we've had a great impact on the health of Geelong through the funds that have been raised by the Geelong community. And every single dollar that's been donated has been put to a really good cause, not just in providing great comfort and care for today, but also investing in the future so that we've got funds should another health crisis hit our shores. So I just want to say to everyone online and to my colleagues online as well, I wish you all a very happy, safe and healthy Christmas. But I also want to acknowledge that for some people, Christmas period is a real challenge and a really tough time. So for all of you out there that will be having a bit of a challenging time or a different time this Christmas, our heartfelt thanks and support is with you as well.
Thanks, Zoe. Thank you, Jacob. Thank you, Jacqui. Thanks, Philip. And thanks, Kate. And thank you on behalf of the Barwon Health Foundation Board for joining us today and for all that you contribute. Our panellists are going to depart in a moment, and we're going to leave you with that wonderful montage again of the year that was for the Barwon Health Foundation, the year that you have contributed to, that we couldn't have done it without you, and we thank you very much. We wish you the happiest Christmas and the safest and healthiest 2021. Thank you again.
The first Noel, the angels did say, was to certain poor shepherds in fields as they lay, in fields where they lay keeping their sheep on a cold winter's night that was so deep. Noel, 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 born is the King of Israel. They looked up and saw a star shining to east, beyond them far, and to the earth it gave great light, and so it continued both day and night. Noel, 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 born is the King of And by the light of that same star,